Again, I want to recognize my public health workforce in both counties. This is a monumental task. They've been at this for over 9 months now. And, I'm continually amazed every day I go into work and, see their smiles and they're still keeping, a joyous attitude even through all these difficult times, long hours each day, weekends, around the clock. So, I'm very proud, and I think we should all be proud of the workforce that we have, trying to help keep us as safe as we can during this pandemic. So again, this can't be done without them, and it's not easy, but they're continuing to stay the course and doing a great job. So I just want to make sure I continue to say that because it's very important to recognize them. So I'm going to run through a few things on updates on some data locally and just some of these other different big ticket items that we're working on locally in Genesee and Orleans County and frankly around the state. But I do want to leave plenty of time for Q&A. So, once I get done with a few of my updates, we'll open that up and take questions on anything that you may have. If we can't answer them now, we will do our best to get them to you as quick as we can. We like to think we have all the answers sometimes, but we know we don't. This is a very fluid situation, literally changing by the minute, especially when we talk about the vaccination component of where we are now with COVID. Just got off a call right before this one, and things are changing and continuing to evolve minute by minute when it comes to this. So again, our goal is to try to provide as much factual, real-time information as we can to keep our public informed as best as we can. Again, I just wanted to reiterate on Chairman Stein's comments around contact tracing. Again, this is a difficult thing and challenging process, and it does take time. I do believe that we are doing a very good job locally in our two counties on the case investigation piece, which is when we get the positive cases in, we have to do the investigation, right? Look back 48 hours, who are they in contact with, identify all those contacts, get their information. It takes time to do that, but we're pretty close to being no less than a day to 2 days maximum behind on those investigations, depending on how many positives we get in during the day. But at that point, it does kick over to the state contact tracing system. And there is a delay there. The state is in the process of hiring hundreds and hundreds more contact tracers to help with this effort as our positive cases continue to rise locally and around the state. But at that point, these are contacts of the positive. These are folks that are going to be on quarantine. So it's very important that, and I can't stress it enough, and I know Chairman mentioned it, that we want these folks, if you've been identified or you've been a close contact through the positive themselves, that you start quarantining immediately. We realize that there's a delay, and again, we've heard it's up to 4 days to 6 days. We don't like that. That is not something that we want to see. But again, that is a system that's outside of our control at this moment. We don't have the capacity in-house to do all of this ourselves anymore. So we're just asking people to be patient and understand that if you are supposed to be quarantined, you will receive that call at some point. And it may be delayed, but the important thing is you start self-quarantining. Don't wait for that call. Just start doing that. And if you do have problems, again, you can contact us locally. We are your direct interface, and we are here in your community. So we want to make sure you feel free to call us. But if it's a delay, we're just going to probably relay that to you. But we're happy to help try to facilitate and deal with any issues that you're having directly with ComCare and the state tracing system. So again, we're just asking for people to be patient with that and understanding, but start quarantining immediately. That's the key thing, and we can figure out the paperwork side at some point down the road on that. As we move forward, the other thing along the quarantine piece, I wanted to mention, obviously this was in the news earlier this week, the quarantine period has changed. New York State has now adopted part of the CDC's recommendation when it comes to quarantine. You may recall back in November, the CDC made some recommendations that quarantine be reduced to 10 days, assuming the individual did not have any symptoms during that period. They also recommended potentially a 7-day test out option. New York State did not adopt the 7-day test out option of quarantine. They went with the full 10-day period. So that is what is the new law of the land when it comes to quarantine for New York State. Anybody that's currently on quarantine that's been adjusted or is being adjusted, so they will be released after 10 days, assuming again they have been symptom-free during that 10-day period. We still need folks to monitor for symptoms up to that 14-day period. There still is a smaller percentage that someone could come down with COVID after 10 days after an exposure. So we're still asking folks to monitor and obviously contact or go get tested if you start to become symptomatic after the 10 days. But you will be released, assuming everything checks out after 10 days. This change also applies to travel. There still is the test option for travel where you can test 3 days prior to coming back to New York State, 4 days when you get back with a 3-day quarantine. So you can test out, or it's now 10 days if you want to do the quarantine for travel related quarantine period. So all right, so I want to talk about some of the numbers and data real quick. So we continue to put this out on a daily basis. And again, a quick shout out to our PIOs who this is a thankless task, I will tell you that, at least from their perspective, probably. They every day have to crunch data. I have epidemiologists pulling data. Again, my PIOs pulling and putting the data together, and this is a lot of work. I know we get some grumbling sometime in the community and some of the comments of why things don't add up, or there's a number off here or there. And the reality is it's complex. There's a lot of moving parts. We're not a large staff, but we're doing our best to keep up with the data. And we do put out corrections, obviously as they're notified or identified to make sure we're trying to keep it as accurate as possible. And that's been our goal from day one. Again, providing this locally and accurately as best we can. So another thing just to note especially on the positive sides, our numbers don't always match up with the state of New York. And I might have mentioned this at our last town hall here. We publish our positives based on the case investigation piece. So after we know there are cases, they're not duplicates, they're not other county cases. And after that we've gone through the investigation process, our data is reported upon that component. If you want raw data, the state of New York does publish positives just raw, again, on a daily basis. So our numbers don't always line up exactly, but our numbers are true, actual positives that belong to Genesee or Orleans County. Again, a day or two lag in that, depending on how quickly we're moving through those positive cases. But just some real quick high-level numbers. Genesee County, as of our report yesterday, was at 2,374 positives. 65,126 negatives. We currently have 173 active cases. So these are folks that are currently under isolation. And we have 489 folks that are under current quarantine. 29 deaths have been reported in Genesee County and 1,854 recovered. And to clarify too, we did put this a bit in our briefing, the recovered category doesn't necessarily mean that they're no longer potentially ill or having some complications. This purely means that they've cleared our 10-day isolation period. So we follow them for a minimum of 10 days, assuming that they are fever-free for 72 hours and an improvement of symptoms. We release them from isolation. They're no longer considered infectious. That does not mean they're automatically well. We've heard that many times. Oh, well, I'm still sick, or, I'm still testing positive if they went and got tested again down the road. That can happen. We have cases of people testing positive for several months after their initial exposure. But again, for our tracking purposes in the data, they are released after 10 days. This holds true also for hospitalizations. If we have folks that are in the hospital, once they hit the 10-day mark and they they meet the criteria, they're released. It doesn't mean they're necessarily well enough to leave the hospital and get discharged, but for our number purposes, they're no longer tracked by us. The state regional office, they may track them a little bit differently, but locally, we track the folks that we have under isolation. Real quick, Orleans County is at 1,342 positives, 34,209 negatives. We have 195 in active isolation right now, and 601 under mandatory quarantine. 61 deaths, and again, the majority of those were in our long-term care facilities last spring, and 914 recovered. So again, currently hospitalized, again, of our active cases, we have 4 in Genesee and 21 in Orleans. And again, the deaths to report are 29 for Genesee and 61 from Orleans. So again, regionally, when you look at positivity rates and where we are, overall, Genesee County 7-day rolling average is at 11.2%, and the 14-day is at 11.5%. And Orleans County is at 9.1 for the 7-day and 8.4 for the 14-day. As Matt mentioned, these are a lot higher than we want to see. We'd like to see those numbers come down. Again, they're fairly reflective of the Finger Lakes region in general. We've been hovering fairly steady. Genesee, unfortunately, still remains a little bit higher than most of the region, but again, we have not been seeing a significant increase, so it seems to be leveling off. As far as the color designations are concerned, as Matt mentioned, we are still yellow for Batavia and the town of Batavia. That has not changed. Again, our numbers, as we look at them, we probably qualify, and most of the Finger Lakes region, and frankly, most of the state has the positivity rates anyways to qualify for yellow, orange, and or red, if not any of them. So again, the governor seems to be pivoting a little bit away from the micro cluster designation approach. As in not designating new, he's focusing on hospitalizations. And again, Finger Lakes continues to be, unfortunately, the worst in the state at the moment, with about 0.08% hospitalized due to COVID. But again, this is a regional issue when we look at hospitalization and bed capacity, and we work very closely with the healthcare system and working on this issue. The healthcare systems obviously have identified surge capacity and different additional bed space that would be available as needed. And we continue to monitor and watch daily hospitalizations and bed availability, both regular beds and ICU beds. So that's a little bit on the data. I did want to shift a little bit over to testing. So as was mentioned, we are continuing to do our testing clinics through the county. Again, shout out to all of our volunteers in both counties. This is, again, a mammoth effort, and these folks weekly continue to come back. We haven't scared them off yet, and we're very pleased to see them come back to give of their time. This is not something that necessarily they're all getting paid for, and they're showing up with smiles and a happy, willing, giving heart, and we're very appreciative of that, and the residents of our community are very appreciative of that. So we continue to test well over 500 every time we do a testing clinic in both counties. So with Genesee, a couple of weeks before the holidays, we're testing about 11 to 1,200 folks a week, and in Orleans with the one, again, over 500. The last 2 weeks with the holiday, we've only done one testing clinic both weeks due to the holiday, but next week we do plan to go back to 2 in Genesee. So those will be on Tuesday and Thursday next week, same place at the emergency management facility. And Orleans County is going back to Wednesday next week, and that'll be at the Orleans County Fairgrounds. Again, as mentioned, please sign up. We need folks to pre-register for these. There is a link so that we really have a good idea of the volume and the ability to handle the folks coming. We need folks to pre-register. Again, the focus here is asymptomatic testing. If you happen to be symptomatic, we'd encourage you to, utilize other resources in the community to go get tested. But again, asymptomatic testing is something that we've really needed for a long time, and we want to make sure that we're focusing on that opportunity for our residents that need it. One thing to note, if you've been exposed to a positive and you're on quarantine, we get a lot of folks that want to come right away and get tested. We really recommend that you look to be tested about day 5 to 7 after an exposure. Most onset of COVID after that exposure doesn't really start happening until at least day 4 in most cases, but the highest number of percentage is day 5 to 7. So, running out after an exposure a day after and you get tested isn't really going to necessarily identify and show that you're going to be, negative over that course of the quarantine period. So we'd encourage folks to delay running out and getting tested immediately. The other thing we wanted to put out there is if you are positive, we really don't want you showing up at our testing clinics or any site to get tested again. I think there's kind of this misnomer out there. I want to go get tested again. I don't believe the test was right. The reality is it doesn't change anything for isolation. When you test positive, you're going to be on isolation for that full minimum 10-day period. In addition to that, it takes up a slot of someone that may need to know if they're positive or negative. And as I mentioned earlier, you more than likely may test positive for weeks or months after your initial positive test date. So we really don't want folks coming to these clinics that are positive or were positive necessarily. We want to reserve these for folks that need it for to, again, find out if they are positive or for work or travel or whatever type of testing purpose they may have. In addition to that, again, our continuing local other facilities are continuing to do testing, so we'd encourage you to refer to the New York State for New York testing site to see what other available opportunities there are beyond those testing clinics. One thing I do want to note with testing, again, as we move into the vaccination phase, which I'll talk about in a minute, this is going to be a monumental task for our communities to try to vaccinate all of our folks twice. So, if I look at the Genesee Orleans region, we're talking about essentially 200,000 vaccinations. If everybody is going to receive the vaccine, about 100,000 people 2 times. So this is not going to happen overnight. And we are going to start shifting our resources a little bit away from testing towards vaccination. Those discussions are happening right now. So as far as the Genesee County testing is concerned, again, we are planning on testing 2 times next week and more than likely the week after that. But moving beyond that, there may be a shift depending on where we need to put our resources to maybe down to 1 day per week. More information will come out on that. I just wanted to put that out there so people had that in the back of their minds. We are committed to continue to provide this testing as it is very important and something we've needed. But again, we have to balance many competing priorities, and with limited capacity and staff, that's going to potentially involve shifting some of those resources to vaccination efforts also. All right, so on the vaccine front, this is very fluid, as all COVID has been, right? It continues to change minute by minute. Vaccine is starting to flow. We're starting to see that in our community, starting to come out. We do have a hub. The governor has put up regional hubs similar to the regional control rooms. So we are in the Finger Lakes region for both Genesee and Orleans County. We are part of that hub. I just got off a call this morning with the hub leads, which is URMC, University of Rochester Medical Center. They've been designated by the state to oversee the COVID vaccine operation for the Finger Lakes region. So under the hub, there is a network that's being put together that's going to look at fair allocations, equitable access to the vaccine for the entire region. We do have folks that are on that task force, and again, I do have regular conversations with the hub directly. This again is a vaccination campaign unlike anything we've ever seen in New York State, and it is going to take some time to get it up and running. It's one of those things, the vaccine's flowing, starting to come in slowly, and we are putting the pieces in place to make sure that we can get that out to our residents as quickly as we can. But it is going to take a little bit of time as that process starts. Currently, we're in the 1A group. So again, I know there's been information put out there on the different prioritization groups and how that's developing. But right now, it is only 1A, and that's really focusing currently on our EMS providers that fall under that prioritization group. Obviously, our healthcare workers, which have been getting done internally at UMMC and Orleans Community Health, our Oak Orchard, our FQHC locally, they've been vaccinating internally. I did get an update this morning, and at the end of the day, UMMC will have been vaccinated about 284 of their employees that qualify under the 1A group. And Oak Orchard Health in Orleans County is up to 108 of their healthcare workers, and they've started doing some small pods Tuesday and Wednesday. They've vaccinated 80 community members in the 1A group, mainly EMS. So we're currently working on getting the rest of our clinics set up. We have a couple set on Saturday over at Orleans Community Health, and then our first one at UMMC. Again, focusing on these 1A categories. These are not open to the general public yet. They're not for general essential workers or certain, different levels in the community. These are really targeted towards these 1A groups, and these are not local prioritization groups. I just want to be clear with that. We are not setting these. We are not, allowing certain people to get vaccinated or not. This is all being controlled at the state level. We do not have any discretion to vary from that. The governor's been very clear that any unauthorized use or vaccination outside of the prioritization groups and at the blessing of the State Department of Health could result in the loss of medical licenses and credentialing for New York State, in addition to fines up to $1 million. So none of us, and I'm sure Matt and Shelley, don't want any of us, especially on the county level, varying from that. Again, there's a very strict oversight at the moment. And again, the vaccine's scarce. It's starting to roll, but it's not widely available. So at the front end of this, I do believe there's going to be very, very tight control. But hopefully once we move through this 1A group and get into 1B, which opens it up more to general essential workers, we'll be able to utilize our community partners more, our healthcare providers, our pharmacies, other places in our community that we traditionally use for vaccination delivery. But at the moment, it's very limited. Vaccine can only be shipped to the hospitals, the FQHC, or starting next week, the local health department. We're the only three that can receive this vaccine. We can't transfer it. We can't reallocate it. It has to stay in our possession, and any activity and pods that are done, again, have to be done through these groups. So we'll continue to push information out on that. Our goal is to move through the 1A groups in both counties as quickly as we can. On the nursing home side, again, this is being done through the federal program using Walgreens, CVS, and a couple other pharmacies. They have started vaccinating in both Genesee and Orleans County. That rotation has been set up by the state, so that is occurring now. And their goal was to try to vaccinate all the nursing homes in New York State within the 3-week period. I do believe they're behind on that a little bit. But again, it has to be done twice. They got to do the facility and come back 3 to 4 weeks later, depending on what vaccine they happen to be using. So we're not focused on the nursing homes. We're focusing on the 1A community side, and the nursing homes are again being taken care of through the states and federal pharmacy program. What we've heard from the state is, just for reference of numbers, Orleans County and Genesee, for the 1A bucket, and this includes the nursing homes, there's about 4,892 in Genesee County that qualify in the 1A group. And in Orleans County, it's 3,421. So you can get an idea of the size of the number of folks that fall into that group that we need to vaccinate first before we can move to 1B. The state has told us they don't expect the 1B category to be able to move to 1B probably till late January at the earliest. It all depends again on how quickly we can move through the 1A group. And again, we can't go there till we're allowed. So even if we feel we're ready to move, we need the blessing from the hub and the state to move forward. In the 1B group, there's about 13,000 for Genesee County and about 9,000 for Orleans County. And the 1C group is about 13,000 again for Genesee County and about 9,500 for Orleans County. So that kind of makes up the first one prioritization group, and then obviously bucket 2 is the general public, which is the remaining balance, I guess, from the numbers I just put out there. So again, a lot of vaccines, and they have to be done twice. The vaccine we're going to be using in Genesee County and Orleans in the community is going to be Moderna for now. The Pfizer vaccine obviously has very, very high cold chain requirements, which we do not have local freezer capacity for. So we will be using the Moderna, which is much more user-friendly in the community. So that process is underway, very fluid. And again, stay tuned. We will continue to communicate and push out information locally on when and where and how this vaccine is going to be delivered. But right now, we're just asking, again, folks to be patient. We understand we've waited a long time for this, ourselves included, for this final phase to hopefully move us forward and move us through. But at the moment, it is very limited, and we got to move through the channels again that the state has set up. And hopefully we can get good participation and get folks signed up quickly and get them vaccinated so we can continue to move forward. All right, so those are the key areas that I wanted to touch on. And as promised, I want to leave plenty of time for Q&A. So I know Matt and Shelley are still on. So depending on the nature of the question, maybe one of them will jump in and answer it, but we'll do our best to answer any questions. Please, when you hop on, state your name and what affiliation you have. And again, we'll try to get the answer back to you as soon as we can.
Well, this is Dan Fisher, WBTA. I just wanted to clarify, out of the number of vaccines that have been put in the arm in Genesee County, are you saying it's only 240?
At the end of today, it'll be about 284 of our healthcare workers. Again,
does that disappoint you that number is not higher?
Well, yeah, I would have liked to start vaccinating a month ago when the vaccine, first was getting approved a few weeks back. I mean, the reality is it takes time, right? This is not going to happen overnight. These are a large amount of vaccines that have to go out, and one of the limiting factors is really we do have to follow these prioritization groups. I mean, if I said I had 400 doses, and we'd have 400 people show up probably in about 10 minutes to get the doses. But again, in line with the prioritization, hitting our high risk folks first, right? We want to make sure that we protect them as soon as possible. We have to move methodically through that process. So the goal we have is to make sure we're trying to get through the 1A group within the next week or two, which will put us in position to hopefully move to 1B when the state allows us to do that. So again, there's a lot of effort and conversations going on, and plans being operationalized, which again includes, the county and the testing component, which I mentioned earlier, starting to look at how we can, shift that over to the vaccination effort. The other thing that, Dan, is a little limiting here is the vaccine availability. We can request vaccine. I could request 10,000 doses today, but we may only get 50 next week. So again, it's really based on allocations to population ratios. And as the numbers I mentioned for each one of those categories, the state gave us those numbers so they know how much vaccine they plan on giving us. So we can request all we want, but we're only going to receive what comes in. And in Genesee County, the initial shipment that came in for the community side was about 400 doses. So as you can see, that was significantly less than the 1A bucket. So again, we continue to request more, and as it comes in, we're going to continue to push it out as quick as we can.
Hey, Paul, real quick.
One more question, if I may. Just one more question. Do you see, Paul, anything in the data so far, which just seems to be running rampant here in Genesee County, but do you see anything in any of the data that gives you hope?
Yeah, well, I think there's always hope, right? I mean, we gotta hang on to hope. Tis the season too, right? The reality is our numbers have not really been climbing. As I mentioned earlier, they've been staying fairly steady. They're not where we'd like to see them, but I think they are reflective, if you look across the state, of the positivity rate. As I mentioned on our last call, the hospitalization is more concerning to me than obviously just the general positivity rate overall. And again, that's been fairly high. It dropped down, with people clearing off of isolation, at least from our tracking purposes. But, I think the hope is the vaccine, right? And as I just went through the process a little bit about that, getting folks vaccinated, getting them protected, especially our most vulnerable, the nursing homes, our seniors, those with underlying health conditions. That's really where we need to focus right now. And I think as we start to get them vaccinated and protected, I think that's going to put us in a whole different position as we start to move forward with risk and exposure potential, which I think is going to move us, hopefully to where we need to be. So I think the hope is, yes, if you look at the data, it's not where we want it to be, but I believe over the next month or two, we'll be able to start shifting that in the direction we want to see it.
Hi there, Jeff Perval with Channel 2 News in Buffalo. My question has to do with contact tracing and with testing. Are you seeing any issues with people actually being able to get a test? Are there any reported delays that you're hearing of? And then on contact tracing, you were talking about the 4 to 6 day roughly delay to do to contact tracing. Has that changed over time? Was it a quicker turnaround, perhaps maybe in the first wave than what you're seeing now?
Yeah, thanks, Jeff. So, in the first question there on the testing, I think with our community testing sites that we've stood up now, as I just went through, basically 3 days a week now in Genesee and Orleans County, access to testing has improved significantly. We had a lot of complaints early on, and ourselves included were complaining that we did not have local testing. It was only for symptomatic folks, and everybody else had to drive to the state-sponsored sites in Monroe or Erie County. With the local rapid testing now, I think we've kind of turned the corner on that. We're in pretty good shape when it comes to testing availability. There still is a delay on the lab testing. It may be 2 to 4 days to get back results if people go to a healthcare system for symptomatic testing. where, you know, again, they go out to a third-party lab, and so there is a little bit delay getting results back, but access to testing is not too much of an issue that we're seeing right now. When it comes to the tracing piece, just to reiterate and to be clear, the contact tracing, hearing back after 4 to 6 days doesn't necessarily mean that you haven't been identified and the investigation isn't done. So we are on top of, and we're again, within a day to 2 days max, reaching out to all these positive cases in our counties. You know, and to be honest with you, a lot of people know even before we call them, because they're going to get a call from the lab. They're going to get a call from their, you know, provider that says, look, your test came back positive. We get the results from the state reporting system, ECLAIRS, which could be even delayed, you know, half a day or a day. So the contact tracing piece is really more the notification from the state tracers. And that's where they get their formal paperwork, et cetera, which is why we really want folks, if they've been identified and they know about it, to start quarantining immediately. But to answer, I think, the other part of your question, we did all this stuff locally from the start of the pandemic back in March right through September. We did that all in-house, and I think we did it very well. We got to everybody usually within a day or two, even the contacts. But you got to remember, back especially through the summer, we were having 1 positive a day, 4 positives a day. The contact tracing was very easy. You know, it wasn't overly complex, and we were able to keep up with that. But due to the overwhelming numbers, again, that's been, and we're not alone with this. Every county in the state is using the state contact tracers, which is why they're overwhelmed. So this 4 to 6 delay is really a result of, you know, this shift in high prevalence of COVID right now, and the need to rely on them to do this. So again, the message I want to put out there is just start quarantining. The paperwork will come, and if you have questions, you can reach out to us and we can help facilitate that.
Hey, Paul, it's Howard Owens, the
Hey,
Batavian. Happy New Year.
Same to you.
I got 3 questions for you. I'll give them to you one at a time. The first one, though, is kind of a 2-parter. I wanted to talk about this new variant that supposedly came out of the UK and I guess has been identified in Colorado and California. Does your lab testing, will that reveal if the new variant shows up here? And maybe also just, maybe you could address what you know about the new variant.
Yeah, so good question. So yes, this new variant out of the UK is getting a lot of media over the last week or so. It has not been identified in New York State, at least that I've been made aware of as of me talking right now. It is being tested for out of Wadsworth, so the state lab is looking for this variant. So I don't have the exact number, but I believe it's about 3,000 or 4,000 tests that, you know, that they've run or analyzed have not shown it yet. We do not have the local ability to look for it, so in our rapid testing, et cetera, but we did reach out to Wadsworth and, you know, to see if they would like us to be part of a sentinel process where we could send them, you know, or make sure they get some samples from around here to test for that variant. That has not started yet, but we are in process of seeing if they want us to collaborate with them on that. But as of now, it has not been identified in New York State yet, but with it being in California and Colorado, it's more than likely just a matter of time till it's identified. As far as about the strain, you know, what we do know is it's a lot more infectious, so it spreads a lot easier, which, you know, is the concerning part. What we do know is it's not any more aggressive or, you know, severe, it appears anyways, than the strain that we've been dealing with locally. But that, again, could change, you know, as time goes on. We don't know a lot about it. It's a new strain. But we do know with the infectivity being a little more aggressive that more people may get sick quicker, which again is the concern with higher positivity rates and mainly with stress on our healthcare system. Because, you know, again, if we have more folks getting infected, presumably more at-risk folks are going to be infected, which is going to put a strain on our, you know, bed capacity and ability to deal with those folks that need higher level of care in the region. So that's really the biggest concern, is that it does appear to spread a lot easier, and that could again lead to quicker overwhelming of our medical system.
My next question is, you talked about late January for the 1B group getting vaccinated. Who exactly is in the 1B group?
Well, that's a great question. So the state, I mean, we have a general idea. So this is certain essential workers. That's where law enforcement, fire, you know, those type of folks, you know, would start to fall in the 1B group. The state has, I don't know if this is intentional or not, but have not really fleshed out the details of the 1B group yet. They're really wanting us to focus on the 1A group. So we do have some more detail again on what those buckets look like, and that is up on the state and governor's website, the 1As and the one, that level. But, when you get into the details beyond that, it is a little more vague. So we'll be pushing more information out as soon as we get that, but we do know it's going to include a lot more of the essential workforce, which is why that number grew, and it's a much bigger number, about 13,000 again for Genesee County. So, that will be a lot more vaccines that are going to need to be done. The other complicating thing, as mentioned, was when we get to the 1Bs late January, hopefully, we're going to have to start revaccinating all the 1As again. So it's every 4 weeks. So, you're basically going to have to double that effort because we need to revaccinate, and we have to really stick to the EAU use of Moderna, which was 28 days. So we need to make sure we're getting that second shot to folks at that 4-week mark while trying to vaccinate new people in the 1B group. So this is really gets into the complexity and the logistical challenges of this vaccination campaign.
So my last question is really something a reader contacted me about yesterday, and that's this Medical Reserve Corps, which I don't necessarily know a lot about. I just have to go on by what she talked to me about. But I guess surrounding counties have set these up, and I guess there's some provisions locally already for it, but we really haven't. She's suggesting we haven't really called on volunteers yet. Where are we at with the Medical Reserve Corps? Do you think that would help in the vaccination process?
Yeah, so great question. So we actually do have identified or adopted a formal Medical Reserve Corps. We've had one up in Orleans County for many years now. And Genesee legislature approved that, expanding the Orleans County one into Genesee about 1.5 years ago. So Medical Reserve Corps, they do have obviously an important role to play in helping in medical emergencies. As you mentioned, there are other counties that have them. I know there's other counties that don't have them also. Every county, has some level of a volunteer group, whether it's a Medical Reserve Corps or AmeriCorps or, some other, group that has been, in place to help out with county government and other functions in the county. So I will say, our Medical Reserve Corps, unfortunately, is not overly robust and populated, so to speak. Serve New York, which is the statewide volunteer group. So anybody that would be in a Medical Reserve Corps has to sign up through Serve New York. So what I would encourage folks to do if they want to volunteer and be part of, not just here in Genesee and Orleans, but any locations in New York, to go to Serve New York, sign up. They do credentialing. Again, if you happen to be a medical professional, a nurse, or any other level, that wants to help volunteer. And then what happens is we need volunteers. We get, we can call up and activate those members that are part of Serve New York. They're automatically adopted into our Medical Reserve Corps, regardless, because it's the same process for credentialing and approval. So we will be utilizing folks again through Serve New York and our MRC through that process. But I will say, regardless of formally having folks officially in the MRC, as I mentioned earlier, our vaccination efforts, that's truly that's basically a Medical Reserve Corps, right? These folks showing up and volunteering to help work vaccination or testing clinics and presumably vaccination clinics. So ultimately, I'm hopeful that by the time we get done with this campaign in 3 to 4, 6 months, we'll have about 200 or 300 people in our Medical Reserve Corps, because once we have them captive, we're going to keep them. So, hopefully we'll have a very robust one moving forward. But yes, it is active, and it's we will be utilizing volunteers quite a bit over the next 4 to 6 months.
Hey, Paul, back on the vaccine distribution just for a second. So you guys are doing, or in Genesee and Orleans County, healthcare workers are being vaccinated, and are CVS and Walgreens, are they in the nursing homes yet?
Yeah, so we're focusing on the community side with the healthcare system for the 1A group, and the nursing homes are starting to get done. I know that they've been to some of our facilities in both counties. Again, we're not necessarily looped into when they're coming specifically, but we know that they have been starting to do the vaccinations in our nursing home facilities in both Genesee and Orleans County. and that is being done through the federal program utilizing Walgreens, CVS, and I think another couple of pharmacies.
Hi, Paul. Jen Lukey here from News 10 NBC. I'm wondering what your conversations have been like with the hospitals lately about capacity. We know we're starting to creep up here in Monroe County. Because you're sort of in between the two major metropolitan areas, do you have a choice on where you send your hospitalizations, and have you been asked to make any changes or considerations?
Yeah, great question. So yeah, we sit right in the middle. So half our folks go to Rochester, half go to Buffalo way, right? But so we talk locally pretty much every day now with our hospital CEOs in both Genesee and Orleans County. And, they're, at least at the Genesee County side, UMMC, they're part of Rochester Regional. So, they are an affiliate hospital. Orleans Community Health is still a little more independent, but they don't really have a lot of inpatient bed utilization there. So again, when we look at hospitalization, it's really a regional issue, right? So, we're looking at what's available in the region. And we do know that even bed capacity in Genesee County, there's folks from not just Genesee County there. Rochester Regional kind of plugs and plays their folks, where they need to, best put their people. So when it comes to the bed capacity, yes, we talk to them regularly about that. It is a concern, obviously a concern of the governor's when he looks at the Finger Lakes region. And our folks, again, they do go both ways. We have residents that are in, obviously the Erie County hospitals along with the Monroe County hospitals. And we have folks from Monroe, et cetera, in Genesee County. So again, this is something that we talk about regularly and, do whatever we can to make sure we have as much available bed capacity as we can.
And I just wanted to follow up on something you said earlier. You have not started any EMS worker vaccinations, any firefighters, anything like that? Because I know that has started in other counties.
Yeah, so in Orleans County, we started a couple of clinics the last 2 days. So we've been moving through that, and Genesee has their first one set up for Saturday. So those campaigns are starting. Again, the hospital's first task, if you looked at the governor's prioritization, was to do internal vaccinations first. So I know UMMC has been very aggressive in moving through getting anybody that qualifies in their system vaccinated, which is, again, that 284 number I mentioned. So again, they'll be moving to the EMS and the other 1A categories starting Saturday, along with several clinics already set up for next week. We at the health department in both Genesee and Orleans, we're going to start receiving vaccine, and we'll also be assisting in the campaign to try to get the 1A group done as quick as we can.
Thanks.
Yep. Have any other questions?
Yes, Paul, Dan, once again.
Yeah.
Do you know how many vaccinations have been given to nursing home residents in Genesee County?
Nope, Dan, unfortunately, I do not have that number. Again, that's being done kind of in a third-party process, so we're not necessarily involved in that. So we do know that it is happening, but I can't give you a number. You'd have to probably
So
check.
the 294, or excuse me, the 284 that you mentioned were, am I correct to assume that's employees of UMMC?
Those are, yes, healthcare workers that qualify under the 1A within the UMMC system. Yep.
Thank you, Paul.
Yep.
So, Paul, this is Shelley. I just had some people ask me, how am I going to be contacted when I am eligible, and what do I need to know about where to go to get a vaccine? So the who, when, how type questions that I'm sure that you are getting inundated at the health department, which is great that people trust you to be the ones to call, right?
Yeah, no, it's a great question. And unfortunately, I don't have all the answers. So I'll be perfectly honest, right, and transparent here. We're trying to put that together. So the reality is, once we start to, again, this 1A bucket is very specific and very, pointed at certain folks and certain occupations. Once we get to the 1B, that's where we're really going to be into the bigger bucket, more community-based with essential workers. So we will have obviously a list of all the vaccination sites. And again, this is going to be a collaborative effort. My hope is that, again, the governor opens this up to our community partners. Again, healthcare providers, pharmacies, other general locations within our community that folks that fit into those categories can actually just make appointments and go to their doctor or go to a pharmacy and get the vaccination done. As far as the county side, we will be listing, obviously, all of our vaccination locations along with the times. We'll be using CDMS, which is the state's management system. That's the current plan anyways. There's, again, discussion at the state level on that, but no different than how we sign people up for testing. We'll have a link. You're going to go on that link. You're going to, fill out a pre-registration form and go through the process, and then you'll sign up for a time slot. And then you'll show up at that location at that time, and we'll vaccinate you and your family or whoever is signed up for those time slots. So we will have it very it'll be very transparent and available once we get to that point. It's just a little bit too early in the process to give you details on that at the moment.
So also, people are concerned about the cost of a vaccine. Is there any cost associated with being vaccinated?
Yeah, so the great answer here is no. There is no cost to the end user, receiver, whatever term we want to use. It is free of charge. Essentially the state is allowing providers or the vaccinators to charge an administration fee. So you may very well be asked for your insurance information because they are being allowed to bill the insurance for that fee. But if you don't have insurance or there is going to be no out-of-pocket cost to, again, the receiver of the vaccine. Essentially there may be, a billing process involved, but it will not cost you anything to receive the COVID-19 vaccine.
Thanks, Paul. Those were questions that I've been asked.
Sure, those are great questions.
Thank you. Matt, any following thoughts?
No, I'm looking around to see if anyone has their hand up or if anyone has any additional questions. Paul, you did a great job with a very comprehensive beginning to cover a lot of the items I think people might have questions for and good thorough answers. Final opportunity for anyone that has a question. As always, Genesee County officials, as Shelley and Paul and I are always available for reaching out. In addition, Paul has done a good job getting out there and messaging through some other additional interviews. And we welcome the opportunity if anyone has any additional follow-up questions through email or phone. We welcome that. We definitely want to provide the information to the public. Shelley, great comments on people wanting to know how do they find out when they're getting vaccinated. And we will continue to have these as often as we can to continue to push out information and use other social media outlets as well to push the information out. But with that being said, one final opportunity. I want to thank Paul and Shelley for your time on New Year's Eve here. I wish everyone a happy New Year, and I can't wait for 2021 to get here and 2020 to exit. Take care, everyone.
Thank you.
Thank you all.